coming from a chiropractic background, I was not vaccinated as a child, and I had measles, mumps, rubella, chickenpox, and pertussis. I missed most of the 3rd grade when I was growing up, and they wanted to hold me back a year. So in September of 2000, when I went to the NVIC meeting, which is the National Vaccine Information Center, I heard all of these people talking about problems with vaccines. So I went home and I thought the best place to start was looking at documents from the Centers for Disease Control, the CDC. And I read the 1998 version of General Recommendations of Vaccination, and I said, this 42-page paper is it? This is the basis and the science and the research behind vaccination? I said, well, maybe I better look into this a little bit farther. So over the course of the last 9 years or so, I have spent thousands of hours of my own time, approaching 10,000 hours of time, researching problems that could be caused by vaccination. I've looked at all of the documents from the CDC. I've looked at the peer-reviewed medical journals, like the Pediatric Infectious Disease Journal, Vaccines, and I found that there is an enormous body of information that people don't talk about when it comes to vaccines. They don't talk about vaccine injury, vaccine damage, what kinds of problems vaccines cause inside of the immune system. So since that time, I've gotten very involved with letting people know that there was another side of this story beyond what we're basically told, that vaccines are safe, effective, protect you, and harmless. In vaccine research, when they talk about safety, that's really a short-term process by which they've determined that definition. A vaccine safety study only goes on for sometimes as little as 5 days from the time that the vaccine is injected, that they follow for side effects and particular complications. A long safety trial is usually somewhere between 21 and 30 days.
Dr. Jay Gordon, a Santa Monica pediatrician whose patients include Jenny McCarthy's son Evan, takes this concept a step further.
There's just not enough science to prove that the way we give vaccines, the combination of vaccines, the way we manufacture vaccines, the way we test them, there's not enough science to show that what we're doing is completely safe. And it is not incumbent upon me to prove that it's dangerous. It's incumbent upon the manufacturers and the powers that be, the AMA, the AAP, the CDC, to prove that it's safe.
First of all, there has been no study that I've seen that looks more than a few days past the date of the vaccine being administered. And one of the concerns that we have, and which has been shown that vaccines has the opportunity to cause immunological issues, in particular inducing autoimmune diseases. And those are not the types of things that usually appear over the course of 2 to 3 days. It may not occur for months afterwards. And so if we aren't studying to look at the long-term consequences of it, we can't say it does or we can't say it doesn't, but the theory has not been ruled out because we haven't looked that far out.
Pediatrician and author of The Vaccine Book, Making the Right Decision for Your Child, Dr. Bob Sears, explains his opinion on how the vaccine industry works.
Private companies make the vaccines, and so they're the ones that have to pay for and initiate the research, because the government doesn't have the funding or the money to do the research, and the government isn't making the vaccines itself. So the original research has to come from the companies that are making the products. But then what needs to happen is the research needs to then be taken over by some unbiased organizations, groups that don't have any financial stake in the outcome. And I think if we change our system where we allow companies to make profit and make vaccines and do safety research, but then they hand it over to people who are completely uninvolved and have no financial stake in the research, let those groups of people then start making the decisions, I think parents would feel a lot safer about the whole vaccine system.
A couple reasons why looking at vaccines and how the body were to process them is different than what happens in the outside world. The outside world, we are exposed to things through either breathing them in or through swallowing them, of which there are certain white blood cells, certain types of antibodies that exist on our lung tissue and on our intestinal tissue that serve as our first line of defense against those organisms. When we inject something into somebody, a bacteria, a virus, we are bypassing the body's first line of defense. The types of white blood cells, the types of chemicals that are parts of the immune system called cytokines are different in terms of the first response and then what happens in the pathway of the immune response afterwards when it's been injected. So you can't really make that coordination because we're supposed to see the toxins through our liver get processed first. But again, if we're injected with a toxin, it could go anywhere in the body and not just through the liver. When you eat something, everything goes through the liver before it goes to the rest of the body.
Well, Dr. Paul Offit is right in that we are exposed to millions of germs and millions of antigens every day. And babies' immune systems probably can handle that exposure. But what Dr. Offit and many doctors don't realize is all those antigens and all those germs are not injected directly into our bloodstreams like vaccines are.
Dr.
And come down.
When it comes to the vaccine question, we knew 50s and 60s that those who were vaccinated did not have the same stamina with their immune system regarding an infectious disease as those who got it naturally, meaning that if you got vaccinated, and operationally we still know that to be true today, that the vaccines only can afford a temporary immunity. I got chicken pox as a kid and measles as a kid, and once you got it as a kid, you have a permanent immunity. If you choose the path of vaccination, you need to get vaccinated every 5, 7 years, or however the amount of time that science has determined is necessary. And it's very short-lived memory. It's why you need to get the boosters.
One of the things that was surprising to me when I started doing this research was to find out about all the different types of ingredients that were in vaccines, the additives, the preservatives. There's this long list of chemicals of things like aluminum and formaldehyde and 2-phenoxyethanol and animal cells and gelatin, and the list is very long of the types of particles that are in there. And then started looking at what is called an MSDS sheet, which is the material safety data information on these particles, thinking, why are we injecting milligram amounts of these chemicals into babies that are 10 pounds in weight, and that these have additive effects? And it's not as if the children are just getting one shot, one time of something that has formaldehyde or aluminum in it. There are multiple shots over time.
Given to infants.
There's a new argument out by the CDC about mercury and thimerosal. They say the science is done. We don't have to talk about it anymore. Mercury doesn't cause autism. How can we say that it's perfectly safe to inject this into a body when we tell females who are pregnant that they can't eat tuna fish because of the mercury?
Thimerosal is 70% ethyl mercury. That is not put into vaccine to make the vaccine work. That's put into the vaccine to keep the vaccine sterile, because nothing will grow in anything that has thimerosal in it. It's very effective antiseptic, or it could be even a disinfectant, depending upon the way you look at it. It is a neurotoxin because of the mercury component, and they outlawed mercury in the vaccines. The drug companies pleaded that their manufacturing process cannot totally remove all the mercury. So the government conceded that some of the drug companies are allowed to make their vaccines with mercury in the thimerosal in the manufacturing process, so there still are trace amounts of mercury in the vaccine. Parents who are interested in that can go to the website vaccinesafety.edu, and on that website you can get to a thimerosal table which will show you which drug companies' vaccines are totally mercury-free, which ones have their vaccines with a 0, and the 0 will have an asterisk, and the asterisk says that this vaccine has trace amounts of mercury, but according to the federal government, it's considered to be mercury-free.